Very good afternoon, everyone, and welcome to today's webinar. And I'm Ketna, and I'm thrilled to be a host for today's webinar, and Ragini will be in support. So welcome to today's webinar hosted by Dentee Educate, and it gives me the immense pleasure to extend a warm welcome to all the participants joining from the various corners of the globe. So today we are honored to have with us Dr. Rajdeep Samaddar, a seasoned senior consultant dental surgeon and the visionary founder and CEO of the Dentogenesis group. So Dr. Rajdeep, his extensive expertise and passion for the dental healthcare has not only transformed the countless smiles, but also inspired many within the profession. So his dedication to advancing the field with his commitment to patient care has earned him the widespread admiration and respect. So Dr. Rajdeep will be sharing invaluable insight and knowledge gained from his experience. So before we dive into our webinar, I would like to take a moment to introduce you to the Dentee.
A very good afternoon, everyone, and welcome to yet another session. It's a huge and it's absolutely amazing and interesting for me, and it's a pleasure for me to conduct such a session because it's a very important topic nowadays that we dental surgeons are missing out. And thanks for such a warm introduction. Dentee Educational Platform software and patient management software, they are doing a great job. As I was going through their portal, just tell me once whether I am audible or not properly.
Yes, doctor, you're audible, and I think your screen is not yet visible.
Yeah, I have not shared my screen yet till now, so I'll do it shortly. Just a moment. Yeah, I hope you can see my screen, right?
Yes, doctor, yes, it's visible.
Okay. So, just a minute. Okay, so at any point of time, if you feel that my voice is breaking or the visual is not coming clear, you can definitely just unmute yourself and tell me. So first of all, welcome to Dentogenesis, and we will be moving on with this beautiful topic today. And the weather is very hot. And we are just amidst the sultry summer that already set in 2024 so much early. And thanks to Dentee once again for bringing such important topic into play. Like in India, only we have around 1.5 billion population, which is the highest in the world. And every year, 20 to 25,000 dental surgeon graduates. But even after that, the medically competent dental surgeon is very less in the market if you see. So whatever it does, like the ratio of dental surgeon is to Indian citizen is 1:10,000, which means for every 10,000 patient, there is one dental surgeon. So practically and mathematically speaking, there should not be any problem with anything because there are so many patients to do, right? But still, the vacancy, the loophole in the market is due to the medically incompetency of dental surgeon to handle each and everything. So just a short, yes. So that was a short video from Dentogenesis. And good afternoon once again, myself, Dr. Rajdeep Samaddar. Many of you know me directly or indirectly. And today I will be taking on some important topic that I was already said. So first, whenever I start off any conference webinar, I always focuses on this picture. Okay, so this is a picture of Lord Ganesha, which symbolizes prosperity and wealth, which I think we need most in our field. Okay, so in this case, I would request everyone to observe three important things of this picture. Number one, the big ears, the gigantic size of the ears, which shows that we have to imbibe, we have to listen very carefully what is going on in the surrounding. Next, you watch the eyes. They are very short. And it's precise and accurate. So in dental surgery, we always have to very much precise in our diagnosis, calculation, and accuracy. And lastly, the mouth is not in the scene only. वो तो छुप गया अंदर, ठीक है, वो तो दिखाई भी नहीं. मतलब, let's not speak. Just learn, watch, and observe. Okay. So this is my alma mater where I belong to, and I were studied and completed my undergrad before I joined. So this is the important person that which everyone should remember, should be grateful forever, because like now already 100 years of successful dentistry in Indian subcontinent has passed, and since from 1920 the practice has been huge for this person, Dr. R. Ahmed. And without any ado, I'll just move on to the session without any delay. Okay, so now we will currently move on to the medical emergencies in dental practice. Okay, so let's begin with a very simple and short thing. One fine day, we are doing RCT on a female patient, right? And this happens suddenly. The patient twisted her head to the right side, and these jerks that are creating, just check out. So if this thing happens in your clinic and you are alone, there are only 3% there, your assistant, your patient, and you. So this is what a medical emergency look like in dental practice. Okay, so first thing first, right? We all know being a dental surgeon is very pretty difficult to get a name in the practice, and suddenly this happens, and within 1-2 days, it's already there's a huge rumor surrounding your practice that this happened in clinic. Now, very few people will actually see the medical emergency was arising from the patient, or it was iatrogenic, like induced by the practitioner. So we can land up in such a plight, okay, because we deal with super age instruments, we deal with medications and various type of patients. Yeah. So we have to learn how to act in such a situation. Okay. Now, like, we cannot predict when it will come, but if it comes, let's commit that after today, we at least learn to manage an emergency. Then hospital is there, ambulance is there, public will come and help, not mostly, but sometimes. Okay, that depends on luck too. But initial emergency we can manage, right? So whenever or whatever be an emergency we find, the very basic thing कि ये तो हम सबको पता है कि पल्स कैसा लाइक देखना होता है और ब्रीदिंग इज प्रेजेंट और एब्सेंट. Just judge these two things. Forget everything in the world. Just check these two things. If the patient is not having pulse, if the patient is not breathing, forget everything. Start BLS followed by ACLS, including high quality CPR. Now today I'm not here to explain you BLS, ACLS, or CPR, because I will be discussing rather top 20 medical emergencies of various types that can happen. BLS and ACLS, CPR will work only and only when if the unconsciousness, fainting, pulselessness, or breathlessness is due to a cardiac origin. This you have to remember. So the question that I gave, that a patient was having tachypnea, patient has fainted in front of you, patient having tachycardia, means pulse is huge, is high. What is tachycardia? Like more than 100 pulse BPM tachycardia, you are finding. More than 25 to 30 breath per minute, you are finding tachypnea, gasping for breath, and the patient is unconscious and lying down. So in this case, you do not need to start BLS. You have to do something else, because here heart is doing okay. You have to find what is the cause of fainting. So as I said, CPR and BLS, ACLS will only work if the fainting or unconscious state is due to cardiac origin. So sudden unconsciousness or collapse can be categorized under your CNS related emergencies, like the central nervous system. That may be due to anaphylaxis, allergic reaction, fainting, general fainting. ठीक है, मतलब डॉक्टर को देख के ही ऐसा घूम गया. ठीक है, और after seeing the final year syllabus of a BDS, then this happens sometimes. So they are general fainting, cardiac arrest, adrenal crisis, stroke or cerebrovascular accident, hypoglycemia, epilepsy, or some idiopathic cause that we are not guessing. Okay, so this time when the patient is like sudden unconscious in front of you, then first things first, you have to check out the vitals and treat the underlying cause. But whatever happens, you have to maintain a patent airway. At least the body should breathe. ठीक है, बाद में यू चेक कि ग्लूकोज क्या है, बाद में यू चेक कि एड्रिनल का कोई क्राइसिस चल रहा है, थायराइड स्टॉर्म चल रहा है, क्या कुछ चल रहा है, यू हैव टू चेक आउट whether it is breathing or not. If you find that it is hypoglycemic, you can do a CBG, capillary blood glucose, random blood glucose, or something like that if a patient is having such history. Okay, in hypoglycemic you can eliminate out that of a cardiac origin, because cardiac origin mein the pulse will go. Okay, if the heart stops beating, the pulse will go first, but in hypoglycemic shock the pulse will not go, instead it will shoot up, it will be huge. Then you can start 20 ml 25% glucose IV. Why IV? If the patient is unconscious. ठीक है, मतलब if you are unable to introduce the medicine or something like that through the mouth, then you have to go for IV. If the patient is just fainted but you see that the alertness is there, like थोड़ा बहुत है, ठीक है, not like पूरा faint, you can give a simple lump of sugar, a fruit juice, instant carbs, 4 tablespoon sugar drink, 150 ml glucose drink, anything and everything will do. Okay, if still unconscious, please consider about giving glucagon. This can work wonder. Glucagon hormone will start the neoglucogenesis from hell even if required. मतलब बॉडी का जो पहले स्टोर रहता है ग्लाइकोजन, that breaks and form glucose. If that is insufficient, body will think of fat. If that is also insufficient, body will think of protein. But जो भी कुछ हो, from hell and heaven it will try to bring oxygen, glucose in your plasma level, so that you at least metabolize yourself, you have ATP and you can take up. So glucagon is the last answer for this hypoglycemic cause. Next we can think about epilepsy. The video that you just saw, which I started before, just a minute, just wait. So the video that you just saw was of a epilepsy, and epilepsy or seizure can be a various category. This time it was like grand mal epilepsy. There can be absent seizure also. Absent seizure is like often confused with daydreaming. ठीक है, मतलब कोई एक बंदा खुद ब खुद अपने आप सोच रहा है कुछ दिन, मतलब कुछ moment in your clinic. That time don't think always that the patient is lost or patient is daydreaming. There may be patient is having absent seizure. Absent seizure में brain for a certain minimalistic moment or time it stops. ठीक है. So whenever the general broad term is epilepsy, there you have to stop all dental procedure immediately. Immediately. Incomplete है, टूटा है, छोड़ दो. नहीं तो क्या होगा? When the patient will start closing his or her mouth, they will take your finger along with it. ठीक है. और कभी कभी ऐसा होता है, always remember in the maxillofacial region, the strongest muscle is masseter, and that is one of the important muscle of mastication also. If during an epileptic attack masseter gets involved, then it's very much it's you know it's hell, because itna bite pressure आएगा that you can't remove your hand from inside the patient mouth. Then maybe at times the operator's fingers may get crushed, may get cut even, and in that case we have to break the teeth and open the mouth. This is the worst situation that may arise. In general, what happens, the tongue, patient will have a tendency to tear up the tongue of himself or herself, because if the tongue gets some like in between the teeth, so you have to do one thing, you have to protect the tongue. Also sometimes it happens that tongue may fall back and may obstruct the airway. ठीक है, because उस टाइम जीनियोग्लॉसस का तो कोई ठीक ठिकाना नहीं रहेगा ना, that will entirely the neuro coordination will erase. So genioglossus will fall back and the tongue will fall back and close. So in that case, you have to lay the patient flat, protect the tongue, as I have already said, it prevents smacking the airway. You have to remove everything, each and everything from inside the mouth. If the convulsion resolve in a couple of minutes, then we are lucky. ठीक है, जाते वक्त मंदिर में पूजा दे देना. If it is resolving within couple of minutes, as the picture is shown, as the video is shown just before the slide. If it is not, then please consider to have 10-20 mg of dexamethasone, diazepam or fosphenytoin, or you can also have 5 ml of Dexona. That is there in the that is there in the screen. Dexona is a very good thing. Okay, so this kind of IM, Dexona IM, diazepam IV, and fosphenytoin is IM. These category are mainly barbiturate they will sedate, they will act as neurodepressant, they will pacify the patient, and they will stop the unnecessary neural stimulation that is happening. Why epilepsy occurs? Epilepsy is actually, it's like switching off and switching on your electric switchboard once at a time. That contraction and relaxation all happens together. So this thing I have to keep in mind, you have to sedate, and you have to defer the dental treatment for that day. Okay. So this was all about epilepsy. Next, we can have generalized fainting. Ekdam generalized fainting. This is very, very much common. Like whenever patient see us in white coat, see us with huge, huge instruments, forceps, scissors, sutures, injection needed, most importantly syringes. Why? Because patient have a general concept that uh, when the baby is not sleeping, when the baby is not eating in their childhood, infancy, mothers used to teach them that some person in white will come, give you an injection, and then you will sleep. So that is a psychological fear. We cannot modify it, right? So what we can do, we can pacify the patient. Point number 2 is the exact thing that I do in my clinic. First, just sharing a small clinical tip from my day-to-day practice. What I do, I carry a very beautiful Bose speaker with me always in my office bag. Whenever I go, wherever I go, I see the patient, check out the age of the patient, the nature of the patient, age and gender. I play Kumar Sanu if the patient is 60. I play Anup Jain if the patient is 30. Full patient, full concentrated dental treatment, no bakwas, सीधी बात, ठीक है? This prevents the lot of chances of anxiety attacks, and the patient will be very much eager to do. Now, let's say point number 3. If the patient has fainted, he or she is not recovering at all. Start the therapy with smelling salt or ammonia capsule. Crush the ammonia capsule and introduce in front of the nostrils of the patient. That will do the work. Okay. And try to do some like tic tacs with your instruments. If the patient is a child or if the patient is very much fearful, you can always use the back of the headrest as your area where you can take and like give the instrument to your assistant or any other person. Do not take directly the syringe, the injection in front of eyes of the patient, so that patient will have a false perception. And lastly, you can move with tranquilizers to pacify the anxious nature. And with that, we have already finished, I think, uh, three green colored names you can see: fainting, hypoglycemia, and epileptic origin. We have already finished here. So till now, is it clear? Like, can I get a feedback? Anyway, madam or Ragini ma'am, just can I get a feedback?
Yes, yes, doctor. Yes, doctor.
Okay. So next time, moving on to the next part. This is a very disadvantageous, and this is a very unfortunate situation. This is called cerebrovascular accident or stroke. This is a good mnemonic. Please try to recognize a stroke. Come on, you all are medical practitioners. We have to understand how a stroke happens. Okay. See, how a severe stroke happens, that will be taught in your second year pathology classes. Okay, here you have to understand how to recognize a person who is undergoing a CVA. So act fast in this situation. FAST. F stands for face drooping. The face will be drooped at one side. The arm will be very much weakened. Speech will be altered. Okay. The sluggish nature, the patient will speak the gibberish in front of you. And T is time to call the ER, emergency room. Okay. See, here we do not, we can't do anything and everything that we need to do, because that will be only done in a hospital or medical setup. But we have a golden time period for every diseases. Like for this stroke, there is one medicine, okay, which is called streptomycin. It's called clot buster. Clot buster, if it is introduced inside the patient vasculature, the clot will be dissolved and the patient will be out of the risk of having a severe ischemia in that spot. That may be in the brain, that may be in the heart, that may be in any other vital organ. So this is all about CVA stroke. Now, if the unconsciousness or collapse is due to anaphylaxis, I will decide it. I will deal it and explain it at the later, because anaphylaxis is one of the most commonest thing. So पहले तो जो थोड़ा बहुत uncommon है वो पहले कर लेता है, and the last for the most important will keep it last. ठीक है, अच्छी चीजों के लिए कोशिश रुकना जरूरी है. Cardiac arrest and adrenal crisis, again it's very common, and there are sometimes idiopathic nature which we also we are not so much confident why the collapse has happened, but we have to check the vitals, we have to revive the vitals, and we have to deal with it accordingly. So if the cases is due to cardiovascular emergencies, then it can be cardiac arrest. इसका मतलब heart has totally stopped, ठीक है, hands up हो गया है. Acute chest pain मतलब बंद नहीं हुआ है लेकिन होने वाला है. अगर if you are not acting in such a way, there might be ischemia, infarction, and stoppage. And point number 3, hemorrhage. I have kept intentionally this point under CVS only, because hemorrhage issue, whenever it will come, we can consider there is a huge cardiovascular discrepancies. That's why I have kept this point. नहीं तो if there is a cardiac arrest, we have to ensure, please check the patient is having zero pulse, the patient is having zero breath, then only start BLS, ACLS, whatever you know. हमको आता है मतलब ये नहीं कि हमको जरूरी है करना in every situation. If a patient is having hypoglycemia, if a patient is having absent seizure, you are trying to give BLS, ACLS, that is not the first line of defense in hypoglycemia. Okay, so ensure breathlessness and pulselessness. Pulse, oh, one more important thing, please do not check peripheral pulses, check central pulse. ठीक है, वो जो CID में ACP करता है ना, central pulse वाला, carotid वाला, you have to do carotid pulse checking. Okay, that is the central pulse. मतलब वो अगर वो कभी बंद नहीं होता. The peripheral pulse may move, go, fluctuate in many situations, but the central pulse will remain constant until and unless the patient is not dying. If a patient is dying, then central pulse will remove, and the patient is having just temporary heart stoppage. So first you have to go for BLS, basic life support. You have to go for ACLS, advanced cardiac life support, and these two things are to be incorporated with a high quality chest compression, that is cardiopulmonary resuscitation. Rescue breath have to be given either directly or you can give via AMBU. AMBU picture is given downwards. Okay. So as I say BLS, ACLS, I remember that 21st January 2024, Dentogenesis celebrated the BLS, ACLS workshop, and many of my brothers and sisters were there. So those who were there, they can relate a bit, and for others, please have the knowledge of BLS, ACLS. It's very basic, it's very easy. First, we have to ensure the carotid pulse and the breath. Then you have to take the position of the rescuer, because you are providing, so you are the rescuer in that case. In Western countries, every police, traffic surgeon, or everyone knows BLS, ACLS, but in our country, only a few people knows. Actually, I learned and I got my license for BLS, ACLS from American Heart Association and National CPR Foundation, which is based in California. And there they are like instructed that entire police department, healthcare department, and firefighters should know this, because they are the first one that faces this kind of attacks. So you have to give chest compressions alternatively, 13 and 30 chest compression and 2 rescue breath. मतलब 15:1 में you can do until and unless it is completely recoiling. If the patient is breathing, then you have won the match. But if the patient is not, then you have to move for the 5th point, which is written AED, automated external defibrillator, that yellow box downward that you can see in my slide. That is the thing that you need to use. Okay? This is only present in hospitals and in certain medical centers if they are willing to buy it. Okay? This delivers a shock of a particular voltage, particular wattage to the patient heart at 2 designated desired position, one at the right shoulder region and one at the position where apex beat is felt. Like you guys remember your first anatomy classes when you were in college, position of apex beat, 5th intercostal space, 2.5 inch to the left, that position. Okay, 2 electric shocks you have to deliver, and hopefully the patient will revive. If not, get an ambulance, shift IPD, start with 3-4 medication that I will discuss at last. So this was all about if cardiac arrest has happened. Now let's say उतना माने उतना बुरी किस्मत नहीं है, till acute chest pain you have got. Patient is feeling severe pain, like crushing pain. Patient is pointing to his or her chest where he or she is feeling the pain, right? So there are two pathology going on in the heart at that time. One is ischemia, one is infarction. Please remember, mainly second year, third year. This is a very common question in your college also. Who comes first, ischemia or infarction? Ischemia happens first, infarction happens later. Infarction is the final answer for the tissue to be dying. Okay. So there you can act sublingual glyceryl trinitrate GTN spray or GTN tablet, sustained release, controlled release, ideally 0.5 mg. Please introduce under the tongue. Wait for a couple of minutes. If the patient is reviving, well and good. If the patient is not reviving, please give another dose. Wait for a couple of minutes. Pray to God instead. Then check if the patient is reviving, well and good. If the patient is not reviving, repeat once again. So, मेरे कहने का मतलब you can give 2 times within a gap of 2-3 minutes or 4 minutes max. Even after giving 2 dosages of 0.5 mg GTN, patient is not having improved symptoms, please suspect an MI or infarction is the latest stage and rush to the ER. That's all you need to do. Okay. Now you have done a good job because glyceryl trinitrate or nitroglycerin is actually vasodilator. Thoda bahut it will do something in the body, right? Even if it is not able to cure, it will do something. Okay. So that much we can do and that much we are allowed or we are considered to do. Okay. So within that you have to give, if you have oxygen, if you have something in your practice, nahi to theek hai, move to the ambulance and shift IPD in inpatient department in the emergency. If acute chest pain is happening, defer the dental treatment, do not do it on that day. Now this thing is very important. One of the most commonest, please mark, commonest hemorrhage. Tooth extraction, minor surgery, pre-prosthetic surgery, vestibuloplasty, alveoloplasty, ridge augmentation, impaction, implant, what so? So hemorrhage, see, patient to jab bhi aayega, you have to check the BT, CT, PT, APTT, INR. If a patient is having a history, देखो patient तो नहीं बोलेगा कि मेरा bleeding disorder है. You have to check it for yourself, and that's why you are taught history taking in third year. ठीक है? So you have to very much impactful in that case. You have to very much judgmental in that situation. If you find that the patient is having dual APA, मतलब dual antiplatelet agent, like patient is having aspirin, patient is having clopidogrel 75, clopidogrel, patient is having aspirin 75 milligram, okay, or patient is having warfarin, that is oral anticoagulant, please consider having the testing for blood test, BTCT, PT, APTT, INR. If the patient is saying जे सिर्फ दांत निकलने के लिए इतना कुछ करना पड़ेगा, ब्लड टेस्ट जरूरत है, मेरा तो पहले भी हो चुका था, इतना नहीं हुआ था, लीव द पेशेंट, डोंट डू. आई एम टेलिंग यू, do 2 to 5 patient less. That will not hamper your practice because you will eventually grow up. This is the rule of time. 1000 days are required for a clinic to run. Okay. Within that 1000 days, if you have the dedication and discipline and honesty towards your fraternity, you will definitely win. But doing one patient wrong, that will ruin the name. That is enough to ruin the name. So whenever there is a bleeding, achieve hemostasis, find out the bleeder. मतलब कहाँ से bleeding का origin है. Suture, this is your most important tip. You know how to join stuff. In the initial video, I think you have seen one soft tissue and some suturing was going on. That was one of our very viral demonstration class from Dentogenesis on suture on chicken breast. So whatever I do, if your extraction is not good, you have teared the tissue, you have messed up with luxation, you have messed up with everything. If you do a good suture, tissue will forgive you, because oral tissues are very much regenerative and very much having faster healing potential than other tissues. ठीक है. स्किन में जब कट होता है उसमें डेड स्किन आता है, मुंह में जब कट होता है उसमें कुछ नहीं आता है. The healing is much faster because vascularization is very high. So that is a good thing that nature has given us to dentist. Okay. And also use anti-fibrinolytic agent like tranexamic acid 500 mg IV in slow infusion if the patient is having severe bleeding. अभी ट्रेनेक्सामिक एसिड इतना भारी नाम लगेगा, इतना हाईफाई नाम, इट्स वेरी इजी बॉस, इट्स पॉज 500. पॉज 500 तो हर कोई देता है दांत निकालने के बाद ना. So that is a oral formulation, but if the patient is having severe bleeding, then you have to stop the fibrinolytic mechanism. So actually human body has one of a procedure which is called fibrinolysis. उसका मतलब है जो क्लॉट आएगा उसको बॉडी डिसॉल्व कर देगा खुद ब खुद. क्यों? बिकॉज वो जो क्लॉट आएगा अगर वो परमानेंट रह जाएगा वहां पर इस्कीमिया आ जाएगा, क्योंकि फ्यूचर में तो ब्लड जाएगा ही नहीं ना. क्लॉट इज अ ब्लड स्टॉपेज प्रोसीड्यूर. सो fibrinolysis is a natural phenomena that a body does to itself so that to ensure that kahin bhi in the vascular system there is no traffic jam, the blood is moving freely and happily. But whenever there is a clot formation, we need the stoppage of blood. That's why body goes for the clotting mechanism, and after that they fibrinolyze it. But I am introducing one drug, anti-fibrinolysis. So this is very easy, you know. I always tell my patient in Kolkata or outside Kolkata also, the dental surgery is one of the part of allopathic medicine. ठीक है, एलो मतलब ऑपोजिट, पैथी माने डिजीज. तो डिजीज जो होगा उसका ऑपोजिट एक्शन आपको देना होगा. फिब्रिनोलाइसिस में ब्लीडिंग ज्यादा होता है, बंद कर दो वो साइकिल. दैट्स व्हाई स्टार्ट गिविंग एंटी फिब्रिनोलाइटिक एजेंट, ट्रानिक्सामिक एसिड 500 mg or other means you can give of any blood stoppage methodology. You can give RF, you can use electrocautery, you can burn the tissues, you can do anything and everything to stop blood. You have to identify. Okay. You also can have the provision of blood transfusion products like fresh frozen plasma FFP or platelet, but I think it will be very much hectic or cumbersome to arrange all for this in your clinic. Before that, you can have this. Always take a proper history of any blood disorder or not. I will tell the history taking last so that you do not miss any emergencies. Okay. So now, सांसें तो रुक चुका है मैंने बोलते बोलते, इतना बोल दिया मैंने. So third will be coming respiratory related emergencies. So that can also have sudden collapse. Okay, like obstruction, asthma is a mechanical stoppage of breathing, collapse or something like that. Okay. So in that case, if you're having an obstruction, like there is some situation, this point number 1, that was the most fear statement in my life. When actually in Indian dental colleges and situations, we are introduced to patient in 3rd year. So मेरा एक ही डर था कि करते समय अगर हाथ से कुछ गिर गया अंदर, it will be lost in the black hole. Because what I could see when the patient is opening my mouth, I can see the evil and nothing is entirely black. It's looked like a well in the tunnel. So that was my fear. So have a very good grip in your fingers. Okay. For dental surgeon, I must say, your neurology, मतलब डॉक्टर का न्यूरोलॉजी बहुत सही रहना चाहिए. Neuro control have to be very much powerful. Spine should be very much powerful because नहीं तो spondylosis is very common in dental surgeon due to the bad posture that we take when doing the treatment. And please be careful with your vision. Always check your vision is okay or not. Okay. Okay. So coming to the main topic, if the foreign material goes into the tract like a tooth or an endodontic file during an RCT or any other object, patient cough out violently. That is good. It will automatically eject out. If it doesn't, attempt for Heimlich maneuver. Now the Heimlich maneuver is the picture that is given in the bottom, the circle picture. Just a minute, wait. Just a minute. I think this picture is blocking the view. I'll just adjust it a little bit. Okay. So sorry for the interruption. So the circled image, that is the ideal posture for a Heimlich maneuver. Heimlich maneuver mein you have to the patient who is choking. Okay. Acha, universal sign of choking is very important. Point number 4. Universal sign of choking is, I will use my laser pointer. Just check out. This is the universal sign of choking. If the patient strangles himself or herself with 2 arms directly, then it shows that patient is having choking, and it is the ideal time to start for a Heimlich maneuver. Heimlich maneuver mein, the rescuer or the provider must stand behind the patient, would grab the patient from behind in the belly, just above 3 fingers, like 4 fingers above the belly button region, You have to identify the diaphragm pull and you have to thrust. How will you thrust? First, you have to give a backward push, matlab towards yourself. Pull the arms towards yourself, then upward. Continuously do this for a couple of times. Then the object will be spilled out by the patient. So I'm trying to push things upward, not downward. Okay. If the inability to speak, breathlessness, or cough, cyanosis, coma happens in these signs, then even after Heimlich maneuver is not working, please, if you can, I'm just saying, if you can, attempt for cricothyroid puncture. क्रिकोथायरॉइड का जो मेम्ब्रेन होता है वो बहुत सामने होता है इन द ट्रैकियल रीजन लेवल. ओके, just the most prominent, you can just check it, the most prominent portion as you move your finger down your mandible, you will have, that is the thyroid cartilage region, and there you can have the cricothyroid membrane. अभी देखो, these are heroic job. This is not कि like वो हॉलीवुड सिनेमा में जो दिखना होता है कि the hero is taking one knife, one pen refill, introducing into the hole. ठीक है, if you can do that is very great, but if you can't do, then you can go for tracheostomy or surgical airway pathway creation, and there you introduce an endoscope to search the things. Okay, so what is the difference of URT and LRT? You can see. Okay, so URT मतलब upper respiratory tract level होगा, वो होगा cricothyroid puncture में. मतलब if it is the patient is able to respond. If in case of LRT, lower respiratory tract obstruction, endoscopy is the only way to find it out. Even if it is not found, take two chest X-ray view angle and 90-degree just to estimate the position. But do not do X-ray when the patient is choking. Do X-ray when the patient is not choking, because देखिए वो तो choking का तो symptoms आएगा ही. If it is doing resolving, you can do a simultaneous on-bed X-ray. That mechanism, that systems are available at hospital level. You need to rush to the ER for that. The next respiratory mishap that we can find is asthma. Asthma तो अगर patient का मान लीजिए he or she is not giving a good history, first and most important, never lay the patient flat. It is a very most important thing that you need to remember. It is the normal anatomy, normal physiology of the patient that whenever a patient is sleeping, okay, the one asthma patient or this nocturnal dyspnea. When I just few weeks earlier, also when I was doing my general medicine class, I was telling in my batch that in case of nocturnal dyspnea, the patient will complain that when I'm sitting, I'm fine. ठीक है, रात में नींद इसलिए नहीं आता क्योंकि when I'm sleeping, I'm feeling my chest tight. I'm not able to breathe. This is called nocturnal dyspnea. So you have to make him or her erect. Normal physiology के मुताबिक more air will be going inside your body if you're sitting. Start oxygen through mask. If you do not have a nebulized one, okay. And if you have some, ask the patient or patient family members some previous similar history. Ask for salbutamol puff by nebulization or direct inhalation. Now the question that I gave in the poll that was done in just the starting, you have to give salbutamol because it is a very much faster induction, faster onset, but it has a shorter duration of action. That's fine. That's not our business. We need a faster action drug. Salmeterol, formoterol, उसे तो start होने में ही patient का आधा asthma वही हो जाएगा नहीं. You have to give salbutamol. Next, always think of giving hydrocortisone IV 200 mg. Why? Because the steroidal formulation will act as a bronchodilator. And there are certain brand name companies, I will not take directly, but they have a formulation as a capsule for mixing both salbutamol, that is the bronchodilator, and the steroid, like corticosteroid wala, in one single ampule. And you can just introduce the ampule in your oxygen mask, and the patient will wear it, and it will definitely help, right? If the symptoms is like improving, then you can give longer acting. If essentially the patient is having nocturnal dyspnea, because patient needs to have a good night's sleep. Now रात में क्या होगा, सोने में मतलब नींद में एस्मा आएगा कि नहीं, सोते वक्त एस्मा आएगा, that is none of our concern as per se, because that is of the chest medicine part. But I'm just telling you for the concept building, mainly for second and third years. Okay, now Also, you have to give adrenaline 10 ml, 5 to 10 ml mainly. IM. I missed that part. Sorry for that. IM 1:1000. ठीक है. Never give adrenaline IV. Patient will reach moon. The body will so much go into sympathetic mechanism that you will be unable to control. And side by side, call for ambulance, keep under observation, release to home. This is the same simple rule. Now the most important thing and my most favorite thing, why I will tell you later. These are drug related emergencies. Certain drug के मुताबिक अगर कुछ होगा, collapse, anaphylaxis or ALA related reaction. Anaphylaxis, sudden collapse. Okay, it is very sudden. क्या होगा उसमें? Or what are the things that I have shown? I have shown hand, histamine, feather, cat, dog, horse, sheep. All animals are there in the back of the patient.
The webinar has ended. Thank you for joining. Goodbye.
Need to scroll it down.
Yeah. Can you see my screen now?
Yes, I'm able to see
Okay.
your screen.
Okay. So, right, good to go. So, I will be wrapping up the last part of the session, which is the drug-related emergency, and it's very important, because we are dealing with local anesthesia day in and day out, which is one of the most important and also potent thing that may destroy your career, at least, because these have a huge effect. See, 1% patient will either respond to the LA emergency, but then 1% is enough to ruin your name in the practice. Okay. So other than that, if a patient is having an amoxicillin allergy, and if you are giving Clavum 625, the patient will immediately start having gastric irritation problem, vomiting, nausea, and the patient will be totally mentally broken down that क्या डॉक्टर है, क्या दवाई दिया, कुछ हुआ नहीं, दांत का तो कुछ हुआ पता नहीं, मेरा तबीयत बिगड़ गया. ठीक है. So these are something that begins with this kind of allergic reaction. So we have huge number of allergic potents like ingredients in our atmosphere. If you talk about drug, we have penicillin, sulfonamide, tetracycline, vaccine, insect stings. Sometimes it is used as a drug in certain cases. We have complex mediated. We have opioid analgesic, NSAID, aspirin. Sometimes PCM also. Very unfortunate people of the world may have PCM allergy, to be very much honest. Okay. Beta-lactam allergy, that is a classified allergy if you see. We have food substance like prawn, brinjal, egg, almond, sea fish, crab. And you know myself, I am allergic to prawn, egg, chicken. Why am I living? The most favorite things of the world are being such an allergen to us. Okay. So for the sake of benefit, patient can go through allergy test for total profile. Near about hundreds of allergen are introduced in minute titers, as I've already said in the previous. See these things very carefully. These are called allergic tests. They are like subdermally done. It is called prick test. There are two categories, prick test and patch test. Prick test for histamine, feather, cat, dog, horse, sheep wool. Most important allergen that cause allergy are mite, termite, dust, dirt, and certain sea substances. Okay. So they are introduced in our body to check out the will, flare, and redness. These three are called triple inflammatory response that I think you guys have read in second year BDS. Triple inflammatory response. तो उसमें देखा जाता है कि किसमें कितना एलर्जी होता है, right? Now see, it is not possible for us, and we also do not know either of these food substances. Wait, just a minute. I'll on my laser. We do not need these things. We do not need these things to know. We also don't need certain drugs that we are working with. We only need that patient is having an allergy. Patient will not be able to answer what is a drug allergy. Patient को पूछना होगा कि कभी कोई दवाई लेने के बाद आपके सांसें फूल जाता है या आपको रैशेस वगैरह कुछ इरिटेशन स्किन में आता है. अगर इसका जवाब हाँ है, then think twice before writing the medicine. Then ask you which medicine is called. Patient will see sulfur containing drug. Patient can say sometimes, okay. Patient का एलर्जी है प्रॉन में, पेशेंट का एलर्जी है एग में, तो इसे हमें क्या? I have seen many interns, many junior dental surgeon are writing allergy to prawn, allergy to, अरे prawn का कोई डिश खिलाना है क्या चेम्बर में? Prawn allergy is not our concern, boss. We have to think whether the patient is allergic to certain medication that I am going to give. Okay. So after, let's say, unfortunate things are happening in your life, your Saturn is not working. And you are having anaphylaxis of patient. Please give 0.5 ml 1:1000 adrenaline IM after 10 minutes. Repeating after 10 minutes. Also give a hydrocortisone, chlorpheniramine maleate. These things will activate the bronchodilation, will reduce the allergic effect. Also give Phenergan, which is very important. That is a first generation antihistamine. You can give if the patient is like improving, then you need to motamuti you can go for a observation, and if not, please check for a serial anaphylaxis, as second anaphylaxis may also happen within 24 hours. And you know what, when I was preparing the slides and PPT yesterday, I got bitten by wasp in my hospital. I work in a district hospital in Kolkata, in Krishnanagar. It's one of the remote district in Kolkata only. I got bitten by a wasp. I just ran to the ER. I ran for my life. I asked for adrenaline. They do not have adrenaline. So these are the conditions of the healthcare centers that we have. But see, we are not here to change the society. We are not here to talk about them. We are here to save our back. Simple work. Okay. So get adrenaline ready in your chamber, or hydrocortisone, or even dexamethasone, Dexona, that once I said previous, that will help in bronchodilation, and one antihistamine. This preparation should be there in your emergency box. And also try to learn some antidotes. Like I think opioid is very important. We can go naloxone, इंसुलिन. इंसुलिन का तो वैसे कोई एलर्जी का सीन नहीं, लेकिन इंसुलिन अगर है उसका एंटागोनिस्टिक काम करेगा ग्लूकागॉन. And then if BSD intoxication is very common, BSD intoxication, we can go for flumazenil or digoxin, that is digitization. Matlab introduction of digoxin, digibind can act as a very good thing. Okay. Lead poisoning, EDTA, because it's a chelating agent. So I would ask you to take a take screenshots. I think if I can request Dentee that the lecture is being recorded or like handed over to our participant also, if they need for doubt clearing and all, that will be very much helpful. Other than I can share my slide at last. I will give my contact so you can directly contact me and take the slide if you need, because these are some important criteria that you need to get like printed in your chamber, because you need it day in and day out to save your back. So the endocrine emergency, that are thyroid crisis, adrenal crisis, and diabetic coma. That point number 3 we already have discussed in hypoglycemia only. The last 2 is thyroid crisis or thyroid storm. These are the 2 broad things that we can mainly have if the patient is having huge thyroid levels, hyperthermia, tachycardia, and atrial fibrillation. You can expect palpitation. First and foremost, please bring down the fever. This is most important. ठीक है. T3 T4 अगर इंक्रीज हो जाता है तो आपका जो बॉडी मेटाबॉलिज्म रेट BMR will increase, and that way you will enter into a stage of hyperpyrexia or hypothermia. Now if the body is having huge temperatures like around 104 105 degree Fahrenheit, then the enzymes will stop working, because you know class 8 or 9 biology में हमको एक definition याद करना होता था, what is enzyme. ठीक है. It works at a particular pH, it works at a particular temperature on a particular substrate in a particular concentration. ठीक है. So यहाँ पर तो temperature का पूरा बिगड़ गया, so that will stop working. So fever is very dangerous if the patient is having huge fever. There is a one thing I forgot to mention, which is called malignant hyperthermia. Malignant hyperthermia may occur when the patient is introduced to GA, general anesthesia, inside the operating room. It's like 2 or 3 patient in 500 patients calculation is having malignant hyperthermia. That is when the body temperature is 108 degree Fahrenheit, 110 degree Fahrenheit. Then you have to bring ice from the refrigerator and throw it on the patient body to cool down the body. Because if the patient is not having the reduced temperature, the enzyme will just kill. Okay. So why this happens? This happens due to a genetic deformity which is acting against the general anesthesia MOA, mechanism of action, and that is having the huge temperature. So that is not yet the spectrum of today's discussion. That's why I have just skipped out. So you can definitely give T3 T4 hormonal preparation if you have, or digitization or digitalization, मतलब digitoxin का introduce करना inside the body if the patient is having AF. This is AF. This is not as atrial fibrillation. Okay. And chronic heart failure is suspected, and IV propranolol to bring down the adrenergic or effects. Now the last one for today, this is adrenal crisis. Now first try to understand why adrenal crisis happens. Okay, so whenever a patient is having a long-term steroidal history, please try taking the medicine history. Long-term steroid matlab, steroid actually suppresses the HPA, that is hypothalamus pituitary axis. Okay, what happens? The body will forget how to produce epinephrine. Matlab steroid white is given. Steroid is given to reduce the local immunity, right? To reduce the inflammation, to reduce every response that the body should have towards foreign object. Steroid is mainly used in autoimmune diseases. Matlab when the body is starting reacting against its own tissues. Okay. So stopping that, we need to give steroid. Now the thing is that steroid देते देते ऐसा हो जाता है कि hypothalamus will stop telling pituitary and pituitary will stop telling adrenaline produce adrenaline. So they will eventually forget the pathway. So even I have seen dental surgeon, they said, please stop the steroid before 2-3 days before coming to toothache. Arey boss, why? This is not the case. If I stop the steroid therapy and start for an excessive surgical or technical field, the body will take it as a surgical emergency. And during emergency, body will try to produce adrenaline. It will not produce adrenaline. And that will arise to adrenal crisis. Okay. Scarcity of adrenaline. You have nothing to do but only to give external exogenous steroids and nothing, and adrenaline. Okay. Just revive the vitals, get for the fluid loss, hospitalization, and observation. Okay. So this is the thing. And diabetic coma I've already discussed. If the case is of a generalized syncope, that is the last thing I would be discussing. As I said, the most important will be discussed at the last. So see, we are dealing with so much medical emergency that we just now had a technical emergency also. We got break, because break is important in your life. This glitch or this pausing of the seminar, what does it actually indicate? इसका मतलब है थोड़ा पानी पियो. Please get hydrated and avoid this kind of emergencies. Okay. So frankly speaking, syncope demands something which is called Trendelenburg position. Trendelenburg position means, now see, this posture is very easy to attain in your dental chamber. We have that provision because we have 1.5 lakhs, 2 lakhs dental chair in our dental clinic in our chair in our clinic. Okay. So it's not a problem, but please try to learn the posture. Why it is being done? So that the heart and the brain receive the maximum flow of the blood due to gravity. This was believed in earlier medicine books, but now the British Journal of Medicine, हाल में they have introduced something which is called modified Trendelenburg position. Matlab the level of the heart. Please look into the pointer, the laser. I hope it is visible. If not, please tell me. Unmute yourself and tell me. The laser pointer shows the position of the heart, and the laser pointer here shows the position of the brain. If I continuously keep the patient in this posture, the blood which is reaching to the brain पहुंच तो जाएगा लेकिन लौट नहीं पाएगा. The deoxygenated blood will not be able to flow back to the heart. So the modified Trendelenburg position says that the heart level should be some inches lower than the brain level. मतलब यहाँ पर जो जॉइंट है हिप जॉइंट, इसको तोड़ देता है. ठीक है, थोड़ा इसमें और एक जंक्शन लगेगा और द नेक्स्ट बॉडी मूव विल बी लाइक दिस और लाइक दिस. The heart should have the lowest position, not the brain. नहीं तो entire blood will flow in the brain, no point of returning. Only oxygenated blood will go. Now see, what happens if there is huge oxygenated blood in the brain? Ultimately, at some point of time, it will be fully of oxygenated blood. There will be no returns, and the reduced hemoglobin will be filled in the brain spaces. Again, eventually, it will be having a same problem because the brain tissue will not get enough oxygen. So syncope will act as a result of fainting, cardiac arrest, crisis, stroke, hypoglycemia, epileptic origin, idiopathic anaphylaxis. I intentionally kept syncope at last because syncope का पहला response है Trendelenburg, दूसरा response है identify the cause. ठीक है, You have to learn these things, Jay. You have to identify the cause. It's not that you only have the Trendelenburg set in your clinic. Only having this will not help you. Try to find the etiology. That's why I kept those things earlier. Okay. So I think we have reached the end of the slide as far as I remember. But before I end, I am indebted to some persons. I'm indebted to my parents and my lifelines because they have believed in me and they are just supported me in my career. These are very hardworking Chief Marketing Officer, Ms. Konkona Pal, who is also from Kolkata, and he is taking the lead for managing the marketing head of Dentogenesis. These are my precious members and volunteers for Dentogenesis. And with that, I end. Thank you for being such a patient listener. I especially thank to Dentee Platform for discussing such important topic on board because these things are very much important. Whatever high-tech dental treatment you do, patient will judge you on the basis of giving how a painless injection you provide, how you manage difficult patient, and how is your behavior or how like you are mentally cool in that situations. So this is very important to learn before you learn a high-tech dental treatment. Thank you, everyone.
Thank you so much, doctor, for sharing such a valuable insights with us. And there are a few questions, I guess, in the chat box, and few have raised their hands also. So I think you should take over them. And
Yeah, I will definitely try to answer them, but
yes, doctor.
where is the chat box? Can you just tell me? I'm unable to find it.
It's in a QA session, I guess. Like the questions are there.
Just a minute. Yeah, I've got it. Yes, I've opened the Q&A and the polls. There are two tabs. I've opened the Q&A. So the question will be appearing here, right?
Yes. So a few of them have raised their hands. So I will unmute them. Dr. Shukla. Dr. Shukla, you can unmute yourself and you can ask the question. Dr. Jesu. You can ask the questions, you can raise your hand. Dr.
Yes,
Shukla,
you can ask the question
yourself
directly. Yeah. I'm unable to see the Q&A part. There's no written question, but you can definitely ask and unmute and ask directly. I will be more than happy to answer them. Yeah, go on.
Dr. Shukla, you have raised the hand. So are there any questions? I think there is a question by Akshadeep. They're asking how to protect the tongue and how we will prevent it from obstructing the airway.
Okay, so that's a very important, pertinent question. I would like to take the question. You can use a simple Babcock tissue forceps. Okay, don't use a sharp tissue forceps or hemostatic end because it will crush. You can use a Babcock. Just lightly hold the tongue and let it be outside. Use a mouth prop or mouth opener and engage inside if the patient is trying to having the tendency for biting the tongue. Okay. Bite probe जो होता है, that is a very strong device used in OT or used in any dental surgical procedure for the patient who are having a very reduced mouth opening. You have a metal bite probe, don't do the rubber one. Patient will crush them. Okay. You can use a mouth opener or bite opener. Okay.
Yes, doctor. There is one more question by Dr. Parag, and he's asking that patient will be checking how to administer diazepam.
Diazepam.
Yeah. Patient won't be stable, so he won't know about.
Yeah. In that case, you have to judge the situation first. You can give the Dexona IM. Okay, that can also work. After Dexona, patient will be stable to some extent than before. Then you can move on to diazepam. Use the sequence carefully. Don't rush and introduce everything at one shot. This is the most important thing. First, you can go with tranquilizers, stabilize the patient, then move with the higher category drugs. I'm also receiving some question in text that how can we differentiate after unconsciousness is due to hypoglycemia or vasovagal syncope? This question is one of the most important questions asked in dental colleges in final year exam. I think there are many students who are going to appear in final exam these.
Uh, Doctor, you're on like we doctor, your voice is not, you're not audible, doctor.
Now can you hear my voice?
Yes, I can hear you.
Okay, so I was reading the question, how can we differentiate after unconsciousness whether it is due to hypoglycemia or vasovagal syncope? ठीक है, अभी देखो, this is one of the important question that is asked in almost every dental colleges, one of the favorite question of every dental examiner in final year exam, and I think this is one of my student only asking me directly. I face this regular question in classroom also. So yeah, this is very important. After unconsciousness, very much difficult to pretty identify. Okay. See, for syncope, for the syncope one, patient speech, patient consciousness will be altered. Hypoglycemia में वैसा कुछ नहीं होगा. Hypoglycemia में, okay, I'm
Doctor, you're not audible.
Can you hear my voice now?
Yes, now I can hear you.
Okay. So just I will repeat what I was telling. So in this case, it's very much difficult to pretty understand whether the unconsciousness is due to hypoglycemia or vasovagal syncope. If the patient is having hypoglycemial deficiency and the patient is going for unconsciousness episode, patient will response. Patient will understand your instruction, but patient will not not repeat or speak promptly. In vasovagal syncope, the neural coordination of the speech will be altered. There will be sluggish nature in speech. Okay. Also, you can have a CBG machine in your unit. It comes like very cheap. You can test the blood sugar level, that is RPG, random blood glucose level in mg per dl. It will come, and you will definitely find whether it is 30, 40, 50. That is definitely a case of hypoglycemia. In vasovagal syncope, it will be still yet normal. I must say it will be increased also, because like body will try to revive itself. Okay. Also in vasovagal syncope, patient will start losing the coordination. Patient will start losing the alertness or consciousness in mind, and there will be very much difficulty for patient to understand the environment. Hypoglycemia में totally the patient will be able to respond. Just weakness होगा और faint होगा. ठीक है. Now the last thing, this is a very unsupportive comparative analysis that I will say now. That is about the pulse. वो जो होता है वो जो normal syncope में, the pulse will be very much increased, very much. It will be labeled to tachycardia, because that is according to Mally's law. The blood pressure will fall and the pulse will increase. So this is not a good differentiator. I'm just telling myself, this is not a good differentiator. The first 2 points are there. Okay. So this was all that I wanted to say. And if there are more questions.
Yes, doctor, there are more questions. Like, sir, can you say shortly about SNACO once again, just shortly, by Dr. Adarsha?
Which one?
Just hold for a second. I'll share you on WhatsApp. Yeah.
Dr. Adarsha Pal is from Holdia, I think. अच्छा, syncope is vasovagal attack. Okay. Syncope का most prominent मतलब जो होगा, that will be reduced CO, cardiac output. अभी cardiac output is decreased due to like hypoglycemia, or it is due to normal fear, or it is due to any sight, any fragrance. That is difficult. That is the first thing that you have to identify. Syncope is a very generalized term. Syncope माने unconsciousness है, ठीक है, और CO is very low. Now that is a generalized concept. और उसके अंदर जो है, what is the etiology, you have to find out, and then you have to treat. अगर patient is having syncope, mostly you have to revive the heart and the brain. So first in syncope, you need to go for Trendelenburg position or the modified Trendelenburg position. Legs up, chest down, brain. This is the most important part. Then start taking for the vitals, check for the pulse, whether it is increased or whether it is normal, check for the glucose level, check for the alertness, consciousness, and other things. Sometimes patient will have suddenly the patient will freeze. Freeze का मतलब patient will stop responding and eyes will be fixed, pupils will be dilated and fixed. That is not a that is not a syncope, or that is not a unconscious, that is a absent seizure. मतलब that is a epilepsy origin. So you have to differentiate which one. Okay, then you can start the treatment accordingly. So this is what I'll already say about Dr. Adarsho.
Yeah, there's one more thing, like Dr. Ujwala is asking, like it was very, like she's giving the feedback, like it was very informative session and she's expecting more sessions from Dr. Rajdeep in future.
Thank you, Dr.
Yeah, definitely, Dr. Ujwala, we will try it out in future. And are there any questions? They can raise their hand. Dr. Saurabh? Dr. Saurabh, you can unmute yourself if you want to ask any question. I think, Doctor, there are no more questions.
Okay. Thank you for joining. I know it's a weekend, it's a Saturday, and still you guys you are spending your time here. Okay, it's a very hot afternoon also. I think most of my juniors and students are in college right now. They are doing their duty, but I know Saturday is a half day, and I know the load of patients that are there in the college. So yeah, I think it's a good time for you also. Thank you, Dentee, for having me on board.
Yeah, welcome, Doctor. I think Ragini is there.
Yes. Thank you so much, Doctor. This is Ragini from Dentee Software, and thank you everyone for joining. Thank you, Dr. Rajdeep, for the